Well, good afternoon, everyone, and thank you for joining us here this afternoon. We know the past 15 months have been extremely challenging for all Manitobans. And now more than ever, people have been looking forward to summer. Of course, May long weekend starts tomorrow, which many view as the sort of the unofficial start of summer. We know everyone would love to spend the weekend connecting with friends, family, and loved ones. Today, we are urging everyone to hang on a little bit longer. We need to work together while staying apart and keep following public health orders a little while longer to help protect our families, our friends, our neighbors, and fellow Manitobans. Today, we are here to announce additional measures for the May long weekend. And I'd like to invite Dr. Roussin to fill us in on those details.
Thank you, Minister. Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. 3 weeks ago, we announced additional changes to the public health orders to help slow the transmission of this virus. 2 weeks ago, we announced further restrictions, again trying to reduce that spread. And last week, we issued even more stringent orders to try to slow the transmission of this virus. Manitoba's public health orders have been and continue to be some of the most stringent nationwide. However, we've continued to see our case numbers climb. Every day, we're seeing more and more Manitobans admitted to hospital and to ICU. We're seeing younger Manitobans being admitted, much younger than what we've seen in that second wave. We're seeing people in ICU who acquired it at family gatherings and potlucks, and our hearts go out to them and to their family, because no one would be intending this to occur, but we just know that's the risk of gathering, and so now we're seeing these severe outcomes as a result of that. And we've been at this for quite some time, 15 months, not being able to spend enough time with our loved ones and being able to see our loved ones face to face. But we all can see the results of not adhering to the orders. We're seeing a lot of transmission. We're announcing case numbers that we just haven't seen before. But I can't understate the importance of us staying at home now. To eliminate contacts outside of our household. We're just seeing such increased transmission right now, increased demand on our healthcare system, especially the ICUs, that we just don't have really any further choice but to issue further restrictions. We need to reinforce that message for Manitobans to stay home, to not have contacts outside of their household. So effective midnight tomorrow, the following orders will take effect. Outdoor gatherings with people from outside of your household will no longer be permitted. Manitobans outdoor must limit their contacts to their household only. This applies to recreation, playgrounds, golf courses, parks. Contact will only be with household members. Only one person per household will be allowed to enter a business. Of course, there'll be some exceptions for people who are caregivers or who require care, but for the most part, that will be one person allowed to enter a business per household. Again, the exemptions to that should be the exception and not the rule. We're in a very critical stage. Right now, our focus should be to limit our contact outside our household. So going out for essential reasons only. That's not a social visit. It would be to purchase essential items, and then again, back home, staying home as much as possible. We have to take these stronger actions to protect Manitobans, to protect our healthcare system. It's of course frustrating because we've been at this for so long, but we can see from our numbers that it's absolutely required to change what we're doing right now. We've had very strict public health orders in place. Despite that, we've seen our case numbers climb. So we need to change what we're doing right now. We made a dramatic shift in the amount of contacts we have. We have hundreds of people in the hospital that are struggling for their lives. There's thousands of healthcare providers that are struggling to provide care for them. So we need to stay at home as much as possible right now. We need to reduce the amount of contacts we have outside of our household, wearing masks, even outside if we're not distanced. It's all up to us. We know what to do. We've done it before, and we've had success with this before, so we're going to have success with it again, but we need to just immediately change what we're doing. Because we had such strict orders in place at the outset, there's very few more things for us to restrict, but the message is clear now, is that there should be really no contact outside your household, staying home as much as possible. These are our collective actions that are going to make the difference. Again, not trying to find ways around the orders, trying to find ways to protect yourself or loved ones or healthcare workers, other Manitobans. Stay home, limit your contact outside your household, and we can drive these numbers back down. So, and those are those fundamentals we've been discussing. So again, please stay home, please limit your contact. Thank you to Manitobans, and I'll pass it back to the Minister.
Thank you very much, Dr. Roussin, and thank you so much for your tireless efforts throughout this entire pandemic. I'd also like to take this opportunity to thank all of our healthcare heroes for your hard work, dedication, and selflessness throughout this entire pandemic, and especially now as we face this third wave together. We thank you for all that you've done and you will continue to do for Manitobans. These are obviously very challenging times. Our hospitals and our ICUs are under significant pressure. They are seeing more patients, sicker patients, and younger patients than ever before. I want to be clear. If you're sick, please seek the care you need. But we must act now to stop the spread of COVID-19. There are two things we all need to do right now in order to shorten the length and impact of the third wave. Follow the public health orders and get vaccinated. We need all Manitobans to do their part to protect themselves, their loved ones, and our community. So I thank you, and we're happy to take any questions that anyone has.
Thank you, Minister. Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CJOB, Schuyler.
Thanks for your time, Dr. Roussin and Minister Stefanson. Whoever is qualified to answer this question can certainly go ahead. Do we have a handle on where the virus is spreading in the province? Or is community transmission largely driving some of these record numbers we've seen over the last few days?
Yeah, so we definitely see a lot of community transmission, which means it's tough to know where people are acquiring it. But we do see patterns, and what we've seen in this third wave, a lot of this third wave, we're seeing a lot of transmission within private residences. A lot of transmission in social gatherings and in some workplace clusters as well, but really we're seeing widespread community transmission. So again, it's about that message that we can't be gathering right now. Wherever that is, outdoors, indoors, we have to immediately end these transmission chains.
Thank you for that. With the necessity not to gather over the next couple of days, why didn't the province just simply enforce a stay-at-home order?
Yeah, and so I think that a lot of this gets at what we were saying is that we've had fairly stringent restrictions in place right now, right? Up to now you can't gather at a private residence, but unfortunately, like I said, we have people in ICU right now, many people in ICU, and that's where they acquired it. And again, our hearts go out to them. It's not about we're not trying to blame or stigmatize. We're just saying this is where the risk is. With a stay-at-home order, there's always going to be exemptions with that, and so we're just not necessarily framing this as a stay-at-home order. The message is clearly stay at home. There's limited things you can do outside your home. And so and there's really nothing you can do outside your home that would put you in contact with people outside your household, for the most part. So really it's the messaging is we have to reduce those contacts outside our household.
From the Winnipeg Sun, Scott.
Hi, good afternoon to both of you. Dr. Roussin, this is the fourth time that you've been on the podium here instituting new rules. Every time it's come with messaging to tell people to stay home, to stay home. The reason why we're here again today is because it seems that messaging isn't. Manitobans are. You can see it. I'm sure yourself sick of this. Why not just put in the orders that would stop this instead of putting in a couple more things that are hoping to, stop the transmission and then continuing with the same message that hasn't been working?
Well, I think that, all along we've, no matter what orders we put in place, we rely on Manitobans. Right, we need Manitobans. That's our strength, and we've been able to rely on Manitobans, a lot through this. Manitobans have stepped up and have brought down our numbers in the past, and we're going to do it again. And there's just so much enforcement that can take place, especially when we're dealing with private residences. So we do need to rely on Manitobans to step up, and I don't have a doubt that they will. I think that seeing these numbers that we have now, seeing the obvious strain in the ICU, I think Manitobans are going to see how important it is to be staying home and limiting their contacts, and we all know that the vast majority already are. We just need to reach the rest of the Manitobans to really step up right now. This is a crisis. We need your help.
Okay, and speaking to that, and thanks for that. And speaking of that, Minister Stefanson, I believe this is the first time you've been on this podium with a health official during the third wave. Why is that? A lot of Manitobans have been, curious as to where you've been. Why haven't you been up here, kind of leading the way alongside your public health or chief public health officer?
Thanks for that. I appreciate the question. And certainly, I actually have been out with Dr. Joss Reimer before, but certainly, it's very important, I think, to be out today to send a very clear message to Manitobans that now is really, please follow these public health orders. And please also, another very important message is to please get out and get the vaccine. That is one of the most important things I think that we can send a message to Manitobans right now. I think one of the things that we're seeing in our hospitalization with those with COVID is that more than 70% of those individuals are not vaccinated. So the important thing here is please follow the public health rules and please encourage your family, your friends, your neighbors, everyone to please get out, book your appointment, and get the vaccine.
From CBC Manitoba, Bart.
Hi, Minister Stefanson. We have very little room, if not no room in ICUs. We have as many as 3 patients assigned to a single nurse. We're sending some patients to Ontario, as many as 20. They tell us. The Premier could not say what the plan is for the number of ICU patients that are expected to increase in the coming weeks, increase by dozens, according to your own model. What is the plan to deal with the rise in COVID patients beyond just sending them to Ontario?
Yeah, so thanks, Bartley, and we are increasing, and we will continue to increase our capacity within the ICU. I know what transpired over the last number of days is that we had a fairly significant surge in the number of patients who required ICU. And obviously during that time, it's very difficult, and there's difficult decisions that need to be made by doctors who are in these positions. And so obviously what transpired was not an ideal situation, but we are looking to increase the capacity, I believe, this week and next week as well. I know that we've added 60 new full-time nursing positions to ICUs in Brandon at Grace Hospital, as well as at St. Boniface and HSC. We're continuing to train more nurses for the ICU, and we'll continue to ensure also we're focusing on patient flow to ensure that people are moving through our hospital system. We've also implemented a virtual COVID outpatient support program, which enables stable COVID patients to be cared for at home. So this is all part of the plan that has been put in place for the last number of months, and I just want to take this opportunity to thank all of those incredible people that have been working diligently day in, day out in our hospitals, in our ICUs, those on the front line, those that have been developing these plans for us. We thank them.
Minister, forgive my skepticism. On Tuesday, you said we could handle 50 more patients. The very same day, 2 patients were sent to Ontario. How many more? I mean, training takes time. I'm aware of the other information. It was first presented by Ms. Saragusa on May 7th, everything you just mentioned to me just now. But how, in the next couple of weeks, when we're expecting dozens of more patients, is Manitoba going to treat them, especially because there is no triage protocol as recommended a year ago by the ethical framework prepared by Shared Health?
Yeah, so I mean, thanks, Barley, and we're continuing, as I just said, to increase our capacity within our ICUs. We obviously got a surge at the time, which was very difficult. We had more people coming into the ICU than those that were leaving the ICU, and so some difficult decisions were made at that time. But certainly we are working towards increasing that capacity even further. And as I mentioned, more nursing positions have been trained. We were preparing, obviously, for this third wave. Some things happen. Things change on a day-to-day, sometimes hour-by-hour basis, and very difficult decisions will need to be made. This is a worldwide pandemic, and we need to be nimble and we need to adjust accordingly. And we'll continue to work with our healthcare officials to ensure that happens. Obviously, we put patient safety and patient health first, and we will continue to do so.
From the Canadian Press, Steve.
Oh, hi there. Given that we're seeing 350, 400, and now a record 600 people getting COVID-19 on a daily basis, that will take time to filter through to hospitals and ICU, but this speaks to a huge bump in hospital demands in the coming weeks. How are we going to handle it? What does the modeling tell us about what ICUs might look like 2 or 3 weeks from now? And how many of those people will have to go out of province?
Yeah, and so you're right. So the hospital numbers will be a lagging indicator. So we'll see, again, a certain percentage of these clients will end up typically in ICU 10 to 14 days later. So modeling, shows again that trend that we're going to see over the next couple of weeks, increasing numbers into the ICU. And of course, once we plateau these numbers, then we'll see that decline. But again, that's going to be that lagging indicator. So there's been a lot of work on increasing capacity and continuing to increase that in the hospitals. But it's just really paramount for Manitobans to realize that we need to end these transmission chains right now. Because we can't continue this increased demand on the healthcare system, and also to note that. These patients that are ending up in hospital, the vast majority of them are not vaccinated. So we have, I believe, 78% of admitted clients last couple weeks have not been vaccinated, and the majority of the vaccinated ones were admitted or became infected very soon after their injection, so that they weren't actually couldn't expect any protection. So vaccine is what's protecting us, and so in a way that's very reassuring numbers. That we have very limited amount of people in hospital who are vaccinated, meaning let's get vaccinated as quick as we can, and we'll start seeing those hospital numbers come down.
And what is the projected peak number of people in ICU? What is the maximum number that Thunder Bay or Ontario is willing to handle? And what is the plan if the latter exceeds the former?
So I can't speak to details on Thunder Bay. That'll be for our healthcare system officials to speak to. Again, as far as the peak goes, remember the modeling numbers. The difficulty with the model numbers, it doesn't tell us what scenario we're on, or what scenario our orders will put us on. So it's very tough to know what that peak will definitely be. And then, of course, our ICU is not limited to COVID patients. We certainly have lots of reasons for other Manitobans to need an ICU. And that's, again, that message that these COVID numbers don't just affect COVID patients. They affect all Manitobans who require health care.
I'll just add to that as well, too, if I can, Dr. Roussin, and obviously patient care decisions are clinical and are made to ensure people's health and safety are put first and foremost, especially in the pandemic, most difficult situations that we're facing today. What I will say about Thunder Bay and Northwestern Ontario is that Manitoba's had a long-standing relationship when it comes to healthcare services between the two provinces. I do know that we have 9, I think, inpatients in our hospitals today who are from Northwestern Ontario. Annually, I think we see about 20,000 Northwestern Ontario patients who visit Manitoba for care. And so certainly, this is a chance where this is neighbors helping neighbors. We will continue, and we'll reach out to other communities as well to help out as needed. First and foremost, we need to ensure that Manitobans have the access to health care that they need, the quality of health care. And so patient safety is and patients' health has to come first, and it always will.
From CTV Winnipeg, Mike.
Hi there. To whoever can best answer this question, I'm wondering you can speak a little bit on COVID-19 hospitalizations among family clusters. My ICU doctors are telling us there's been a marked increase of spread among families, particularly family of essential workers in the third wave. Can you tell us what amount of current hospitalizations are these family clusters, and how is the province going to be protecting the families of essential workers?
Yeah, so we don't have have specific numbers on the family cluster, especially or specifically those that are in hospital. But we do know that is occurring. We're seeing families or members of families that are admitted to hospital, some in the ICU. Some of this includes essential workers. It also includes, just gatherings with, large family gatherings. Potlucks seem to come up quite a bit. So again, that message is to, one is to follow the public health orders. We need to reduce the amount of gathering outside of households. And two is to be vaccinated, right? All Manitobans now 12 and up are eligible. And so we need everyone to get vaccinated as soon as possible to really limit the transmission, but also limit the risks to that individual.
And Dr. Roussin, I wonder if you can just comment on how these new restrictions will impact childcare in the province.
Mm-hmm. For right now, what we knew was that this weekend, what we've seen an example of in a number of occasions is that we're at risk for a lot of gathering to occur over this long weekend. So we ensured that we put some orders in place immediately to limit the risk of this weekend. We're going to again be reassessing things next week and looking at various other aspects like childcare in the coming week. So so right now there's no specific change to those aspects. Right now we're focusing on we need to ensure this is not a large gathering weekend.
From City News, Stephanie.
Hi, Minister Stefanson. Stephanie Olsuk from City News. You spoke about increasing capacity, training more people to work in the ICU. Can you be more specific, though? How many people do we have left to be trained? I know it takes some time, but it seems to me, how many more can you really add at this point? If these plans were laid long ago, like the province has claimed, it seems like we might have them ready to go by now.
Yeah, thanks, Stephanie. I appreciate your question, and certainly that's why we started on this project of increasing, particularly our nursing capacity within our ICUs very early on. And so that's why we're adding 60 new full-time nursing positions to the ICUs. We also have 39 new graduates just as of last month. We have 28 who started a course just last week and 14 that started this week. So this is really going to help increase that capacity because staffing is one of the major issues in terms of opening up and increasing our ICU bed capacity as well. So that's why we're really focusing on the staffing up of our ICU nurses.
Thanks for that. And just a clarification on these specific orders, Dr. Roussin. Do they affect or have any changes for people who live alone? Are they still allowed to meet outside with that one other person that is designated?
That's right. So the in-person or the private residence, the typical exemptions would still apply for people who live alone, and meeting outside would be the same.
From CHVN, Taylor.
Hi, good afternoon. Each long weekend, there is an overall increase in demand for hospitals. Do you have any reassurances from Manitobans who are worried about seeking medical care because of what's happening right now?
Yeah, certainly what I would say, obviously, is that if you need to seek medical care, please do so. We are obviously ensuring that we're increasing our capacity in our ICUs, but we're also we're working on our patient flow within our hospital system as well. And so part of that has actually been moving those who have been in the hospital system who would be better cared for out in the community. They don't necessarily need the hospital care, but we've moved more than 300 individuals back out into the community, into homes where they can be better cared for under those circumstances. And so, again, the patient flow through our hospital system is very key in all this. But I will say to Manitobans, please, if you need to access, healthcare facilities, please do so. But what I'll also say is that please follow the public health rules, and also get out and get your vaccine.
Thanks. And across the world, we've seen things like field hospitals pop up during large surges. Is this something that Manitoba is currently looking into?
I think we obviously have an incident command team that is looking at what is needed moving forward, and nothing is off the table. We're looking at other jurisdictions, what has worked elsewhere, and we'll continue to put together and develop the plan as we move forward. Of course, there is no pandemic rule book. We live day to day and sometimes hour by hour. And, we'll continue to ensure that that we have that and increase the capacity so it's available for Manitobans when they need it.
From the Winnipeg Free Press, Katie.
Good afternoon. Minister Stefanson, the effects of our overwhelmed ICUs are being felt throughout the healthcare system. Surgeries are canceled, emergency rooms have had to close and redirect patients. But frontline doctors and nurses say they haven't been informed about the province's pandemic planning. So why don't these healthcare professionals have access to the hospital's contingency plans?
Yeah, so thanks for that, Katie May. I appreciate your question, and certainly we do have. I want to thank Shared Health for everything that they're doing, and they work very closely with our RHAs to develop plans moving forward, and we rely on them to ensure that we get those messages out to those in the front line. And so, some of those questions that you have would probably be best to be asked from Shared Health, who are developing those plans.
I just want to clarify. You said earlier that 60 nurses are being added to the ICU. Those job postings are still in the recruitment stage at this point, and we haven't been told what the current ICU staffing complement actually is. Is the province going to mandate former ICU nurses to return to the ICU, whether they want to or not?
Again, those decisions and questions are probably best directed to our healthcare professionals who continue to put together the plan associated with what you're talking about. Certainly, we are adding the 60 new full-time nursing positions. That obviously takes time. That's why we started months ago to ensure that the process started. It takes time to train nurses. That's why we started a long time ago to ensure that we started those training processes. And so we're getting people now who have been trained, and then there's obviously a process to filling positions. And so we're in that process right now.
From the Brandon Sun, Kim.
Good afternoon. My first question is, and pardon me if I misheard it, but I do believe you said, Minister Stefanson, that Manitoba has accepted 9 patients from Northwestern Ontario. My question is, if we've accepted those patients into Manitoba Healthcare, are they COVID patients, and how do you explain that to Manitobans who are seeing their loved ones sent to Northwestern Ontario to be away from their loved ones during this time?
Yeah, again, in terms of the details, and it is a good question, an important one, but certainly the details of that kind of a question would be best asked of Shared Health, who will be able to get the detailed answers as to what the protocols are with respect to accepting patients from other provinces.
Thank you for that. My second question is, this is the long weekend and campgrounds are booked, and we're being told that family members are the only ones that are allowed to gather. Are you planning on increasing enforcement at the province's campgrounds to keep tabs on people from other households who are mingling?
Yeah, well, certainly, I think you bring up a very good point, and then I'll maybe pass it over to Dr. Roussin to maybe talk about the orders with respect to campgrounds. But when you bring up the issue of enforcement, I think that's a very good question, and certainly I do know that our officers have been out enforcing these orders. But now more than ever is the time to ensure that, because we have, as Dr. Roussin has already stated, some of the most stringent restrictions in all of the country. And so it's very important that we also enforce those rules as well. And so we will continue to work with, Manitoba Justice will continue to work with law enforcement to try and encourage Manitobans, obviously, to follow the public health orders. But if they're not, there will be fines for the inappropriate behavior.
Yeah, and so in our previous iteration of the orders, the campsites were considered private residences. So again, it would have been limited to household members anyway. But we really need to double down on that messaging, especially with the long weekend coming. So it's household members only on those campsites. And we really need Manitoba to step up. Of course, enforcement has to be out. That has to be part of any plan. But first and foremost, we need to rely on Manitobans to step up with this, to see how critical it is right now.
Our final reporter this afternoon from the Globe and Mail, Shannon.
Good afternoon. My first question is for Minister Stefanson. There are doctors, nurses, First Nation leaders, citizens who predicted this dire situation months and weeks ago, and now say the government has failed to protect Manitobans, failed to act quickly enough, failed to learn from its neighbors like Alberta and Ontario. Minister, are these people right? Has your government failed?
Well, these are very difficult times, I think, for all Manitobans and for all Canadians. I think people have been living with restrictions that they're not used to for a very long, prolonged period of time. And I think Manitobans and Canadians are getting tired. But now is not the time to let up. Now is the time to ensure that you follow the public health orders and that you get vaccinated. Part of the challenge, I think, that we've had, and as Dr. Roussin alluded to earlier, is that those who are presenting in our hospitals right now with COVID, 78% of them have not been vaccinated. It is extremely important for Manitobans and for all Canadians to get out and get that vaccine. It is absolutely critical for us moving forward.
To follow on that, and speaking of our neighbors and the precedents that have already been set for the third wave, when Nova Scotia had 80 cases of COVID per 100,000, that province went into lockdown. When Manitoba had 80 cases per 100,000, restrictions were lifted. What could possibly account for such a drastically different interpretation of public health data other than political influence?
Well, we have outside of the their trajectory was up, and they needed to put restrictions on. Our trajectory at that point was coming down, so we were able to very cautiously loosen things. And then as we saw numbers climb, we did put restrictions in, and the restrictions we had in place, if people were able to adhere to them, we wouldn't have seen this level of transmission, right? We just did not allow any gatherings really in private residences. And we're seeing that drive our transmission right now outside of what our guidance had allowed. So it's really challenging. I think it is it's a period of frustration for Manitobans, how long we've been at this, and I think we may have lost sight about how important and how quickly this virus can get away from us if we don't follow these orders. So we hope we're making it very clear with this message today that we need people to reduce the amount of contacts they have. Really, there should be no contacts outside your household. And now is that time to act.
Thanks, everyone. This concludes our media briefing.